The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. Excited for today's episode. Excited for our guests to get going here. Without further ado, Russ Ledbetter, say hello to everyone.
Hello.
It's grateful to have you here. Thanks for taking the time to meet with us. We'll talk about your website in just a little bit. But first, Russ, tell me how you became a dental consultant. How'd you get in this industry?
Well, some might call it fate, some might call it luck. When I graduated from college in 1989, 34 years ago, this was a family business. And I was going to go into investment banking or some financial markets. And my mother had been a business consultant for all different types of businesses for about 2 years. But then a high school classmate of hers who happened to be a dentist hired her. She did a great job. He told a bunch of people about her. They all hired her. And when I came in 1989, all of her clients were dentists. So basically, she asked me if I wanted her to train me, which I said, sure. And 34 years later, it's the only job I've ever had. Never expected that.
Right? It's amazing how things like that work out. Well, it sounds like you're certainly meant to be here. Tell me, Russ, I know you're down in Atlanta, but you work all over the South and you talk to dentists all over the country. Tell me what problem are you helping dentists solve right now? What's a big problem that they're coming to you for and need help with?
Well, one of the biggest problems is attracting and retaining quality staff, especially hygienists these days seem to be in short supply. I think a lot of them retired during COVID that maybe had a few years left in them. And I don't know if, the younger generation isn't going to hygiene school as much, but there's a shortage of hygienists and quality staff in general. And then also with the increased costs of COVID, the DSO, the private equity, the corporate dentistry who have the economies of scale and can get substantial discounts on dental supplies, profitability is an issue for dentists to make what they're worth and what they deserve to make considering their education and everything.
Sure. And those two things are related, right? If you have to pay a ton to bring on staff, that money's got to come from somewhere. They're demanding more money. So let's tackle both of these monsters that are making one big monster. So what are you seeing? What are you offering? What are you talking to dentists and seeing them do to resolve these staffing issues and get where they need to be as far as staffing is concerned?
Well, two things I would say mainly. Number one is I train my dentists how to write effective ads because nowadays you have to sell them on coming to you. You don't just put an ad out and a bunch of people come and convince you that they're the person you should hire.
Yep.
The job pool is way bigger than the labor pool right now. So you actually have to convince someone. I mean, if you're in a big city, you might get someone move into town. But typically, you're going to be trying to hire, I hate to say it, but you're going to be trying to hire someone away possibly from another dental office that's not happy, or maybe it's closer to home, not as long of a drive or whatnot. So you have to, I don't fish, but I use a fishing analogy. Your ad is the bait. And you can't catch a big fish on cheap, no good bait. You have to have something that's very well written. You have to list all your benefits and perks. And, my clients are actually having to increase the dollars per hour that they're offering to get people to even respond to their ads, unfortunately.
Right.
And that sort of leads into another thing that I do in my consulting is I implement an incentive bonus system for the staff. And the reason that's good is because it sets their salaries at a certain percentage and then keeps them there. So if they collect more than their percentage, they get the same percentage of the increased collections so that they can make more money. But the dentist isn't paying any more money unless he's profiting, if that makes sense.
Yeah.
So in order for them to make more money, he's got to make more money or she has to make more money. So an incentive bonus system is very attractive. However, I would have to say that just I've seen people put them into place. You've got to show your staff how to get there. You can't just put a bonus system that if they don't get bonus, then they get frustrated and they give up.
Right.
So we provide the training on how to schedule very effectively, very low stress, very high productive, consistent scheduling, which is an artwork, to be honest with you, in dentistry.
Yep.
And such that they can increase the production and collections and profitability of the practice, and they can share in that profit. And I like to call that golden handcuffs. So in a book I read a long time ago, it's a term just meant that if you make your job so attractive, they wouldn't want to leave, because
Right.
where else would they go to make the kind of money? But it's not just about paying them more dollars per hour, because your production may not change and then you're
Sure.
just making less money. So it's got to be a win-win situation.
Right. I mention this all the time, and maybe you agree or disagree with this, but I always recommend a bonus based on scheduling new appointments for team members and practices. And the reason why is if you have 30 new patients a month coming into your practice, every patient above that means higher net profits to the dentist, higher net revenues, more income to the dentist. But every new patient over that number means more work for the same pay for your team. So it's more burden on them. It's more workload. It's more in verification. It's more follow up. It's more charts to on and on and on. So giving them some type of incentive to actually get new patients in the door, I think makes a ton of sense. If we'll circle back to that when you have time. If we have time, let's talk about the profitability part of this a little bit. So what are some things that you're seeing that can benefit dentists and help them become more profitable? What are some steps that you can do today to make sure you're putting profits first?
Well, there's several areas I was thinking about. Number one, I would really stress hygiene, because hygiene is the profit center of the practice. The hygienist is there regardless if a patient shows up or not. So she's getting
Right.
paid. If the patient doesn't show up, she gets paid. If the patient shows up, she gets paid. So if she sees 9 patients in a day or 6 patients in a day, you still pay her the same amount of money. And hygiene patients, the overhead is not great. It's a few dollars to turn over the room and a few dollars for the hygiene bag. And depending on where you are, if you're rural, you might be doing $150 a patient. And if you're in a big city, you might be doing up to $300 per patient. So you can greatly increase profitability by reducing broken appointments and improving the show rate. And if you have the patient base there to do it, to actually push and expand hygiene. So most dentists wait until hygiene is screaming at them that we need more hygiene. By that time, you're way beyond where you needed it.
Right.
The staff only fills appointments that are available, and then they stop and go do other things. So most dental practices have room for more hygiene, whether it be a 2-day-a-week hygiene part-time, or some practices have enough to bring on an additional hygienist altogether, 4 days a week of hygiene if you're a Monday through Thursday dentist. So adding hygiene is extremely profitable, and at the same time, when the doctor checks hygiene patients, the more he's checking, the more dentistry he's putting on his books. So that's a way to increase the profitability of the practice from all of your fixed expenses are covered. So if you can grow your revenue, you'll keep more of each additional dollar, if that makes sense.
Sure. Yeah. Makes sense.
Your variable expenses will stay the same, but you'll be much more profitable because your rent doesn't change or your mortgage payment or all that doesn't change.
Yep.
So that's one area. Another area is it's very important to keep your dental supplies under control, because they're one of the staff salaries are the biggest expense for a dental practice. Lab bill and supply bill are the other two. So I usually put my dentist to where they get an assistant and they give her a budget of 5% of the collections. And if she makes that, you give her a bonus, give her $100 a month every time she makes it, because you can actually control expenses when someone's finger is on the pulse and when they're really paying attention. And it's amazing how much you can waste if people are just ordering willy-nilly and using supplies and, hey, we need
Oh,
more
yeah.
of this and more of that. So both you want to expand production, and at the same time look at your costs to where you can, save money in the dental office. I mean, it's harder to do with the lab bill because you want your lab bill to be high because the more crown and bridge you're doing, the more profit you're making.
Sure.
So you don't really want to control unless you want to go with a CEREC machine or something like that. But typically you got to be doing 25 to 30 units of crown and bridge a month to pay the monthly payment on a CEREC machine through your savings. So those are some areas I see that really can increase the profitability of a dental practice.
Yep. Great advice. Makes sense. Going back to the ad, you talked about the bait and putting an ad out there when you're attracting something. What's a big mistake that you see people put in their ad consistently over and over and over again that is going to actually do the opposite of attracting a big fish, if you will?
A couple things. The first thing I would recommend that no one run a blind box ad. That just means email your resume to info@gmail.com or some bland generic. Put your practice name or your name, the doctor's name, to make sure, because some people won't apply to somewhere that they don't know where they're applying. There
Right.
are some offices they don't want to work in, and they don't
Right.
know if they're applying to their own office or their own
Right.
office's best friend.
Right.
So
Yeah.
never run a blind box ad.
Yeah.
Now, the other thing is you just make it too vanilla and bland and not attractive. So what I mean by attractive is you want to use positive words like growing dental practice needs dynamic, self-motivating, organized, efficient, friendly dental assistant. So you need to describe exactly the kind of person you're looking for, but you also want to use some positive word about your practice like growing, because people don't want to be replacing turnover. I've seen
Right.
a lot of practices where one person comes in, 3 months later they're gone, and they're constantly no one wants to go work in that environment.
Right.
So if you have a good place to work in a stable environment, tell who you are because it'll help you, but also describe in glowing terms the exact type of person you're looking for, but also sell your practice.
Sure.
Say we're a drama-free environment with all the latest technology and facilities, and we're fun and we're friendly, and describe yourself, sell yourself to the potential prospect, and then list your benefits. Like a 4-day work week is a benefit. If you don't put that, people don't want to, a lot of people in dentistry are used to that. And I don't want to go to a 5-day. So
Right.
that's a benefit. If you have a bonus system, put that. If you have health insurance, put that. If you have retirement, put that. Make sure you list out each and every benefit of what you basically have to convince someone why they would want to leave where they are and come to work for you. Because if someone is unemployable, you don't want them. So they either
Right.
move to your area or they're working at another office and you're trying to attract them to your office.
Right.
And
Hey,
quality
Russ, I
staff
got.
make all the difference. Yeah, go ahead.
Yep. True. Very true. I've got one last question for you before we have to go. Russ, if you're looking to hire a consultant, someone to help you overcome challenges and issues that you have in your practice, how would you go about vetting that person? What advice would you give them and choosing a consultant to work with?
Well, I mean, it's a big step and it's a big investment. And I say investment because I've never been an expense to anyone. I make them 10 times what they pay me. But regardless, if you paid my fee and got nothing, it'd be a big expense. So you want to really look at what other people are saying, not what they say about themselves. Who cares? Everyone's website touts themselves. You want to look at their testimonials, possibly Google reviews. There aren't a lot of Google reviews out there in business consulting or dental consulting. It's just not
Sure.
done. But you want to go on their website and maybe even call some people that they've worked with and get it straight from the horse's mouth. And look, I mean, if someone has 3 testimonials and one is a dental supply rep, one is, an accountant, and one is someone else, that's a warning sign. But if there are 100 dentists that are actual practicing dentists that say glowing things about that person, then you're pretty clear that you're working with someone that knows what they're doing.
Yep.
That's what I would say about that.
Makes sense. Makes sense to me, Russ. For those listening, we'll put it on the website, of course, social media too, dentalconsultingexperts.com. is our web address. Russ, I'm sure people can go to that website, reach out, contact you, get more information. One more time, it's dentalconsultingexperts.com. Russ Ledbetter, thank you so much for being here. We appreciate your time today.
Thank you for having me. I appreciate it.